What is Carvedilol? Carvedilol is a versatile medication primarily used for treating cardiovascular conditions such as heart failure, high blood pressure, and left ventricular dysfunction. As both an alpha and beta blocker, it offers unique benefits by simultaneously relaxing blood vessels and reducing heart rate, improving blood flow throughout the body. Carvedilol has demonstrated significant effectiveness in improving survival rates after heart attacks and enhancing quality of life for patients with chronic heart conditions. Carvedilol, marketed among others under the brand name Coreg, is a drug used in people who are otherwise healthy to treat elevated blood pressure, congestive heart failure, left ventricular dysfunction. It is usually a second-line therapy for high blood pressure. It is swallowed by the mouth. What are the benefits and uses of Carvedilol? Carvedilol offers multiple therapeutic benefits through its unique dual-action mechanism. It is primarily used to manage cardiovascular conditions and improve patient outcomes. Conditions Carvedilol treats. Carvedilol is approved for treating several cardiovascular conditions. Heart failure, condition where the heart cannot pump enough blood to all parts of the body. High blood pressure, hypertension. Left ventricular dysfunction following a heart attack. It's often used as a second-line therapy for high blood pressure. Secondary uses of Carvedilol. Beyond its primary indications, Carvedilol is utilized off-label for stable angina pectoris, atrial fibrillation, prophylaxis against cirrhotic esophageal variceal bleeding, management of ventricular arrhythmias. How does Carvedilol work? Carvedilol operates through a multifaceted mechanism of action that differentiates it from standard beta blockers. Carvedilol works by blocking both beta and alpha-1 adrenergic receptors in the body. It reversibly binds to beta-adrenergic receptors on cardiac myocytes, preventing the sympathetic nervous system's response and leading to decreased heart rate and contractility. This action is particularly beneficial in heart failure patients where the sympathetic nervous system is activated as a compensatory mechanism. Additionally, Carvedilol's blockade of alpha-1 adrenergic receptors causes vasodilation of blood vessels. This inhibition leads to decreased peripheral vascular resistance and blood pressure. The combined effect creates a more balanced cardiovascular response than either pure beta blockers or vasodilators alone, reducing strain on the heart while improving blood flow. Carvedilol dosage. The appropriate dosage of Carvedilol varies based on the condition being treated and individual patient factors. Typical dosage instructions. For hypertension. Starting dose, usually 6. 25 mg twice daily. Maintenance dose, 12.5 to 50 mg daily, divided into 2 doses. For heart failure. Starting dose, 3.125 mg twice daily for 2 weeks. Dose may be doubled every 2 weeks to the highest tolerated level. Maximum dose, 25 to 50 mg twice daily, depending on patient weight. What should I do if I miss a dose? If you miss a dose of Carvedilol, take it as soon as you remember. However, if it's almost time for your next dose, skip the missed dose and take your next dose at the regular time. Never take 2 doses to make up for a missed one. What happens if an overdose? Overdosing on Carvedilol can cause serious side effects, including extremely low blood pressure, severely slow heart rate, fainting, difficulty breathing, seizures. If overdose is suspected, seek immediate medical attention or contact a poison control center right away. What are the side effects of Carvedilol? Like all medications, Carvedilol may cause side effects, though not everyone experiences them. Common side effects. Common side effects of Carvedilol include dizziness or lightheadedness, especially when standing up, fatigue or weakness, low blood pressure, slow heart rate, diarrhea, weight gain, nausea. Dry eyes may be problematic for contact lens wearers. Cold sensation in hands and feet. Serious but rare side effects. Serious side effects requiring immediate medical attention include very slow heartbeat, fainting, worsening heart failure, shortness of breath, swelling, unexplained weight gain. Signs of kidney problems: numbness/tingling of hands/feet, blue fingers/toes, unusual bruising/bleeding, changes in mood/mental status. If you experience any serious side effects, contact your doctor immediately. For severe symptoms like chest pain or difficulty breathing, seek emergency medical help. Precautions and warnings. Several important precautions should be considered before and during carvedilol therapy. Who should avoid this medicine? Carvedilol is contraindicated in patients with known hypersensitivity to carvedilol, severe bronchial asthma or related bronchospastic conditions, second or third degree AV block, unless a permanent pacemaker is in place, cardiogenic shock, severe bradycardia, decompensated heart failure requiring intravenous inotropic therapy. Conditions where caution is needed. Use carvedilol with caution if you have diabetes, can mask symptoms of hypoglycemia. Peripheral vascular disease, can worsen symptoms. Kidney problems, may require dosage adjustment. Liver disease, especially moderate to severe. Thyroid disorders, can mask symptoms of hyperthyroidism. History of severe allergic reactions. Pheochromocytoma, tumor of the adrenal gland. Myasthenia gravis. Non-allergic bronchospasm, COPD or emphysema. Are there any age restrictions for using carvedilol? Carvedilol has not been established as safe and effective for use in people under 18 years of age. Seniors may be more sensitive to the effects of carvedilol, particularly dizziness and lightheadedness. Alcohol or food interactions. Alcohol should be avoided while taking carvedilol as it can increase the risk of dizziness, lightheadedness, and fainting. Alcohol may also worsen the blood pressure lowering effects of carvedilol, potentially causing dangerously low blood pressure. Possible interactions with other medications, drug interactions. Carvedilol can interact with numerous medications, potentially affecting its efficacy or safety. Carvedilol may interact with other blood pressure medications, increased risk of low blood pressure. Fingolimod, increased risk of bradycardia. Insulin or oral diabetes medications may mask symptoms of hypoglycemia. Digoxin, increased digoxin levels. Rifampin, reduced carvedilol effectiveness. Cimetidine, increased carvedilol levels. Calcium channel blockers, increased risk of conduction disturbances. NSAIDs like ibuprofen may reduce blood pressure lowering effects. Certain antidepressants like fluoxetine, increased carvedilol levels. Cough and cold medications containing pseudoephedrine or phenylephrine. Always inform your healthcare provider about all medications, supplements, and herbal products you are taking before starting carvedilol. How should carvedilol be stored? Proper storage helps preserve the effectiveness and safety of carvedilol throughout its shelf life. Keep it in recommended conditions to prevent loss of potency or degradation. Recommended storage temperature for carvedilol. Store carvedilol tablets at room temperature between 68 degrees Fahrenheit and 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. Extended release capsules, Coreg CR, should be stored at 77 degrees Fahrenheit 25 degrees Celsius, though temporary exposure to temperatures between 59 degrees Fahrenheit to 86 degrees Fahrenheit, 15 degrees Celsius to 30 degrees Celsius, is acceptable during transport. What happens if carvedilol is not stored properly? Improper storage may lead to degradation of the medication, potentially reducing its effectiveness or safety. Keep carvedilol in its original container, tightly closed, and protected from light and moisture. Avoid storing in bathrooms where humidity levels can be high. Keep carvedilol and all medications out of reach of children.